ਕੋਵਿਡ-19 ਕਾਰਨ ਸਟਾਫ ਦੀ ਘਾਟ ਨਾਲ ਜੂਝ ਰਹੇ ਹਸਪਤਾਲਾਂ ਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਵਿੱਚ ਓਨਟਾਰੀਓ ਇੰਟਰਨੈਸ਼ਨਲ ਪੱਧਰ ਉੱਤੇ ਸਿੱਖਿਅਤ ਨਰਸਾਂ ਨੂੰ ਤਾਇਨਾਤ ਕਰੇਗਾ। ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਸਿਹਤ ਮੰਤਰੀ ਨੇ ਇਹ ਐਲਾਨ ਕੀਤਾ। ਹੈਲਥ ਕੇਅਰ ਕੈਪੈਸਿਟੀ ਬਾਰੇ ਗੱਲ ਕਰਦਿਆਂ ਉਹਨਾਂ ਆਖਿਆ ਕਿ ਇੰਟਰਨੈਸ਼ਨਲ ਨਰਸਾਂ ਜਿਨ੍ਹਾਂ ਨੇ ਓਨਟਾਰੀਓ ਵਿੱਚ ਪ੍ਰੈਕਟਿਸ ਲਈ ਅਪਲਾਈ ਕੀਤਾ ਹੋਇਆ ਹੈ, ਉਹਨਾਂ ਕੋਲ ਇਹ ਮੌਕਾ ਹੈ ਕਿ ਉਹ ਹੈਲਥ ਕੇਅਰ ਸੈਟਿੰਗਸ ਵਿੱਚ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੋਵਾਈਡਰ ਦੀ ਨਿਗਰਾਨੀ ਹੇਠ ਕੰਮ ਕਰਨ।
As you know, last week, in response to the highly transmissible Omicron variant, Ontario introduced a number of public health measures to curb transmission and prevent our hospitals from becoming overwhelmed. This includes delaying non-urgent and non-emergent surgeries. These were very difficult decisions, especially nearly 2 years into the pandemic, but necessary ones in order to adapt to the arrival of the Omicron variant. But what has not changed is our cautious approach. Our government has continued to make critical investments in our hospital and health workforce to ensure patients can continue to access the health care they need when they need it. Today, I'm pleased to announce that our government is collaborating with Ontario Health and the College of Nurses of Ontario to deploy internationally educated nurses to hospitals and long-term care homes in need of staffing support. Through this initiative, these nurses who have applied for registration with the CNO to practice in Ontario will have the opportunity to meet their application requirements by working in healthcare settings under the supervision of a regulated healthcare provider. More than 1,200 applicants have already expressed interest in participating, and the matching process with hospitals is expected to begin later this week. Expanding opportunities for internationally educated nurses is just one more way Ontario is bolstering its healthcare workforce. We've also invested $5.1 billion to add 3,100 additional care beds to our healthcare system, for a total of approximately 17,000 medical surgical beds.
ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਦੀ ਡੋਜ਼ ਹਾਸਲ ਕਰਨ ਤੋਂ ਇਨਕਾਰ ਕਰਨ ਵਾਲੇ ਗੈਰ ਵੈਕਸੀਨੇਟਿਡ ਕਿਊਬਿਕ ਵਾਸੀਆਂ ਤੋਂ ਹੁਣ ਫੀਸ ਵਸੂਲੀ ਜਾਵੇਗੀ। ਕਿਊਬਿਕ ਦੇ ਪ੍ਰੀਮੀਅਰ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਹੈਲਥ ਕੇਅਰ ਦੀ ਲਾਗਤ ਨੂੰ ਪੂਰਾ ਕਰਨ ਵਿੱਚ ਮਦਦ ਕਰਨ ਲਈ ਗੈਰ ਵੈਕਸੀਨੇਟਿਡ ਬਾਲਗਾਂ ਤੋਂ ਹੁਣ ਪ੍ਰੋਵਿੰਸ ਵੱਲੋਂ ਵਾਧੂ ਫੀਸ ਲਈ ਜਾਵੇਗੀ। ਇਹ ਫੀਸ ਉਹਨਾਂ ਨਾਗਰਿਕਾਂ ਉੱਤੇ ਅਪਲਾਈ ਨਹੀਂ ਹੋਵੇਗੀ ਜਿਨ੍ਹਾਂ ਕੋਲ ਜਾਇਜ਼ ਮੈਡੀਕਲ ਕਾਰਨ ਹਨ। ਉਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਅਜੇ ਤੱਕ ਇਹ ਫੀਸ ਤੈਅ ਨਹੀਂ ਕੀਤੀ ਗਈ ਹੈ, ਪਰ ਇਹ ਰਕਮ ਇੰਨੀ ਜ਼ਰੂਰੀ ਹੋਵੇਗੀ ਕਿ ਗੈਰ ਵੈਕਸੀਨੇਟਿਡ ਲੋਕਾਂ ਨੂੰ ਸ਼ਾਟ ਲੈਣ ਲਈ ਰਾਜ਼ੀ ਕੀਤਾ ਜਾ ਸਕੇ।
We continue to see an increase in hospitalization in Quebec. Our biggest challenge right now is finding enough health workers. We estimate that in the next weeks, we'll need 1,000 additional workers for hospitals and 1,500 for CHSLDs. We're working closely with union leaders to find solutions. For CHSLDs, the situation is difficult, but it doesn't compare to what we saw during the first wave. We have a lot more workers, and almost all residents now have their 3 doses. The vaccine is the key to fight the virus. This is why we're looking for a health contribution for adults who refuse to be vaccinated for non-medical reasons. Those who refuse to receive their first dose in the coming weeks will have to pay a new health contribution. I know the situation is tough, but we can get through this together. We need to focus our efforts on 2 things. Getting the first, second, and third doses of vaccine, and reducing our contacts, especially with older people. So I'm counting on you all. Thank you. Yes, it's a big deal. If you look at what's happening in other countries or other states, everybody is trying to find a solution, a question of equity, because right now, these people they put a very important burden on our healthcare network. And I think it's normal that the majority of the population is asking that there be a consequence. And yes, we will continue to look at spreading the use of the vaccine passport, but I think we have to go further. And I think that right now, it's a question also of fairness for the 90% of the population who made some sacrifices. I think we owe them this kind of measure.
BC ਸਿਹਤ ਅਧਿਕਾਰੀ ਉਮੀਦ ਕਰ ਰਹੇ ਹਨ ਕਿ ਜਨਵਰੀ ਦੇ ਅੰਤ ਤੱਕ ਕੋਵਿਡ-19 ਨਾਲ ਲੜਨ ਲਈ ਵਾਧੂ ਇਲਾਜ ਵਿਕਲਪ ਉਪਲਬਧ ਹੋਣਗੇ, ਜਿਸ ਵਿੱਚ ਐਂਟੀਵਾਇਰਲ ਦਵਾਈਆਂ ਵੀ ਸ਼ਾਮਲ ਹਨ ਜੋ ਵਰਤਮਾਨ ਵਿੱਚ ਹੈਲਥ ਕੈਨੇਡਾ ਦੁਆਰਾ ਸਮੀਖਿਆ ਅਧੀਨ ਹਨ। BC ਦੇ ਸੂਬਾਈ ਸਿਹਤ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਬੋਨੀ ਹੈਨਰੀ ਨੇ ਇੱਕ ਮੀਡੀਆ ਬਰੀਫਿੰਗ ਵਿੱਚ ਕਿਹਾ ਕਿ ਪ੍ਰੋਵਿੰਸ ਅਜੇ ਵੀ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਨਾਲ ਜੂਝ ਰਿਹਾ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਇਸ ਸਮੇਂ 4 ਵਿਅਕਤੀ ਕੋਵਿਡ ਕਾਰਨ ICU ਵਿੱਚ ਭਰਤੀ ਹਨ ਅਤੇ ਉਹ ਚਾਰੇ ਹੀ ਗੈਰ ਵੈਕਸੀਨੇਟਿਡ ਹਨ।
Later this month as well, we anticipate that we'll have additional treatment options that will be available in BC, and we're preparing for that as well. As we've talked about before, there's a number of new antiviral medications, particularly Paxlovid, also molnupiravir, that are under review by Health Canada, and we're hopeful that those will be available. Another important tool to help us keep people out of hospital who are at risk of having severe illness with COVID-19. What this means in the short term is that the restrictions on gatherings and events are likely to remain unchanged for now. And in parallel, we are looking at what we can safely resume now that all businesses have COVID safety plans, starting to put those back in place again too. And later this week, we'll be providing an update on the modeling data and on more detailed information about who is at risk in hospitals. What we're also seeing right now is a changing risk scenario, where the risks for those who are vaccinated is very different, even with this strain of Omicron, from those who are unvaccinated. And I've talked, since we've discovered this new variant, Omicron, about putting together the pictures of the puzzle, the pieces of the puzzle, to get a full picture of how it's affecting us. And one of the things that is becoming very, very clear is that this strain of the virus is absolutely mostly mild in people who have the protection that vaccination offers. But if you are unvaccinated, you don't have that protection, and your personal risk has gone up dramatically in some communities.
ਨਿਊ ਬਰੰਜ਼ਵਿਕ ਦੇ ਸਿਹਤ ਅਧਿਕਾਰੀਆਂ ਵੱਲੋਂ ਸੂਬੇ ਅੰਦਰ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦੇਣ ਲਈ ਇੱਕ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕੀਤੀ ਗਈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਸੂਬੇ ਅੰਦਰ ਰੋਜ਼ਾਨਾ 1000 ਤੋਂ ਵੱਧ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆ ਰਹੇ ਹਨ ਅਤੇ ਇਸ ਮਹੀਨੇ ਦੇ ਅੰਤ ਤੱਕ ਜਾਂ ਫਰਵਰੀ ਦੇ ਸ਼ੁਰੂ ਵਿੱਚ ਸੂਬੇ ਅੰਦਰ ਕੋਵਿਡ ਦੇ ਕੇਸ ਆਪਣੇ ਸਿਖਰ ਉੱਤੇ ਪਹੁੰਚ ਸਕਦੇ ਹਨ। ਡਾਕਟਰ ਰਸਲ ਨੇ ਚੇਤਾਵਨੀ ਦਿੱਤੀ ਕਿ ਸੂਬੇ ਅੰਦਰ ਓਮਿਕਰੋਨ ਰੂਪ ਸਰਵ ਵਿਆਪਕ ਹੋ ਜਾਵੇਗਾ, ਇਸ ਲਈ ਹਰ ਕੋਈ ਪਬਲਿਕ ਹੈਲਥ ਗਾਈਡਲਾਈਨਸ ਦੀ ਪਾਲਣਾ ਕਰੇ।
New Brunswick is currently experiencing its largest COVID-19 wave to date, the Omicron wave. Today, I've been asked to provide you with some details of what Omicron could look like and what its impacts could be. As we know, the Omicron variant is highly transmissible, and though milder than the Delta variant, it is by no means mild. For every 1,000 cases under Delta, we would have expected 60 admissions. With Omicron, we now expect 10. While better, this is still enough to put our health system at risk due to the sheer volume of cases. You can see on this slide our number of daily recorded cases since September 1st, 2021. In October, we went through what was, at the time, our worst wave to date, recording 140 cases in a single day at our peak. When accounting for individuals registering their POCT results, we are now recording well over 1,000 cases per day, and we know that this is underreported. This is above and beyond our capacity to continue testing and recording accurately. Yet we're starting to observe this affecting our total number of hospitalizations. Today, we report 88 active hospitalizations, a new high for the province. This experience is not unique to New Brunswick. In fact, in many ways, this is the first truly national experience of COVID-19 we have had since the beginning of the pandemic. If we were able to reduce our contacts through either seeing fewer people, distancing appropriately, or wearing well-fitted masks inside, then our peak may be cut by a third of what would happen without any changes in public behavior. As I said earlier, Omicron is much more contagious than the other variants we have seen. It is everywhere in this province, and we need to assume that everyone we come in contact with could have it. The next few weeks will be intense, but they will not last forever. We will get through this. My message to New Brunswickers today is this: the best way to prevent COVID-19 right now is to reduce your contacts. This small action will protect your family, reduce strain on the healthcare system, and protect our economy.
ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਆਖਿਆ ਕਿ ਸਰਕਾਰ ਨੇ ਸਾਰੇ ਯੂਥ ਕੈਨੇਡੀਅਨਸ ਨੂੰ ਬੂਸਟਰ ਦੇ ਨਾਲ ਚੌਥੀ ਡੋਜ਼ ਲਈ ਵੀ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਦੀਆਂ ਡੋਜ਼ਾਂ ਕਾਫੀ ਮਾਤਰਾ ਵਿੱਚ ਸਹੇਜੀਆਂ ਹੋਈਆਂ ਹਨ। ਇਹ ਖੁਲਾਸਾ ਟਰੂਡੋ ਦੇ ਆਫਿਸ ਵੱਲੋਂ ਜਾਰੀ ਕੀਤੇ ਗਏ ਬਿਆਨ ਵਿੱਚ ਕੀਤਾ ਗਿਆ। ਤੇਜ਼ੀ ਨਾਲ ਫੈਲਣ ਵਾਲੇ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਕਾਰਨ ਦੇਸ਼ ਵਿੱਚ ਇੱਕ ਵਾਰੀ ਫਿਰ ਇਨਫੈਕਸ਼ਨ ਵਧਣ ਤੇ ਲੋਕਾਂ ਦੇ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਭਰਤੀ ਹੋਣ ਦੀ ਦਰ ਨੂੰ ਦੇਖਦਿਆਂ ਹੋਇਆਂ ਕੈਨੇਡਾ ਦੇ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਤੇ ਟੈਰੀਟੋਰੀਅਲ ਪ੍ਰੀਮੀਅਰਸ ਨਾਲ ਗੱਲ ਕਰਦਿਆਂ ਟਰੂਡੋ ਨੇ ਇਹ ਟਿੱਪਣੀ ਕੀਤੀ।